Good afternoon and welcome to today's webinar, Achieving Clinical Excellence with Artificial Intelligence. Hello, I'm Deborah Hoyt, Axxess' Senior Vice President of Public Policy, and I'm delighted to serve as moderator for today's discussion. Today's event is part of the Axxess AI Innovation Series, where we explore how artificial intelligence is transforming home health, hospice, personal care, and palliative care delivery. AI is increasingly being integrated into home-based care, yet achieving clinical excellence depends upon informed and responsible adoption. Today's webinar examines how clinicians and leaders can build foundational AI literacy by leveraging it to enhance clinical excellence, clinical intelligence, improve operational efficiency, and support workforce sustainability. Our panelists will discuss change management and clinical engagement as critical enablers of adoption, and why partnering with your EMR is key to aligning AI capabilities within your clinical workflows. Today's webinar is offering 0.5 ANCC credits. Details are provided in the slide deck being shared in today's webinar handout tab. All registrants will receive an email in the next few days with a link to the webinar recording and instructions to apply for the ANCC credits. Lastly, we won't have time to answer live questions today. However, the panelists will respond to questions posted in the webinar chat via email. So now it's my pleasure to introduce our expert Axxess panelists. These ladies are wonderful industry experts with many, many years as both home-based care owners and operators, as well as technology experts. So we're in for a real treat today. First, I'd like to introduce Tammy Ross. She's Executive Vice President for Professional Services, Arlene Maxim, Senior Consultant, Clinical Services, and Wendy Conlon, Senior Vice President of Client Experience. So welcome, ladies. So glad to have you here today.
Thank you, Deb.
So Tammy, let's begin with you. Let's talk about education. Why is education considered foundational to AI literacy and successful adoption in clinical practice?
Thanks, Deb, and thanks for starting us out with education. Education is the foundation of what we do. Clinicians are evidence-based. We want to see proof. We want to see evidence in everything we do. But AI is not intuitive in clinical practices. It really changes how we think, how we decide, how we trust. And without education, AI becomes something that feels like it's been imposed on us and instead of something that's kind of been designed for us. So if you look at other industries and you think about our adoption rate compared to other industries, about 70% of companies in marketing, technology, finance, they're using AI in all their workflows, but only 30 to 35% are using them in healthcare right now. Really low statistic, and it gets even lower. 25% are using them in the care at home industry. Even though, if you look at our slide up here, providers know that there's a great impact for personalization of care using AI. They're still afraid to use it. But the gap isn't really that clinicians don't care about innovation. They do. AI literacy is really the bottleneck. Most of those AI tools have a baseline understanding that people are going to understand data, how to interpret that data, how to look at limitations. But that language is foreign to a lot of clinicians. If you look at the age and the demographics of our workforce, about 52 is the average. And about 40% of us are over the age of 55. So we didn't grow up digital natives. You know, we didn't grow up using AI. We didn't learn it in school. So it triggers anxiety. It really invokes anxiety. And we ask those questions. Is this going to replace me? Is it replacing my clinical judgment? Is it watching me? What happens if AI is wrong and I act on AI? That's a biggie. And you can see here our data supports that in a recent industry study. Over a third of providers think, is AI reliable? Can I trust AI? But if we teach clinicians first and that this is clinical decision support, It's designed to keep humans in the loop. I talked to a gentleman today, and he says it's bigger than that. It's designed to put humans in the lead when you're dealing with healthcare. So the humans lead, AI follows behind as a supportive partner. If we can train, we have data to support that 2 to 3 times, the clinicians are 2 to 3 times more likely to adopt AI. So they have to be trained first. So education is just not a nicety, it's a have to be. We have to start with education. It's how AI becomes a clinical partner, and instead of being kind of a clinical barrier.
Thank you, Tammy. I like when you said that AI is becoming a clinical partner. And I think that that's really critical as we're moving into value-based purchasing and, accountable care organizations where payment from CMS to Medicare, home health, and hospice agencies is based on your efficiency and your ability to care for, large populations of patients. We really have to find those efficiencies. And I think AI is the tool to do that. We know that it can help. We know that statistics, and I know Wendy's got some great examples of that further down the line. But I know that, Tammy, you've been working out in the field with Axxess clients and agencies around the country. Arlene, you do the same. So let's hear a few examples from Arlene regarding ways organizations can begin educating their clinicians about AI without overwhelming them.
Right. And, thanks, Deb. And thank you, Tammy, for making some of those comments, because this is going to create a lot of anxiety with a lot of people. And, one of the things that I hear when I'm doing consulting as well, I'm going to lose my license and things like that on issues that they shouldn't even be concerned about. But AI is going to be one of those things that they're going to think that it may create information that they didn't really put in there. So I think one of the biggest mistakes that organizations are going to make or could make is that they're going to treat this as an overall technology change, almost like they're switching EMRs. And that's probably, switching EMRs is probably one of the most painful things that can happen to an organization. And this is going to be that if they don't approach it correctly, they need to be looking at treating it differently. And this is just going to be, as Tammy said, it's going to be clinical support, a clinical support tool. It's not a complete change in technology at all. So one of the things I can think about doing is like micro learning. And so instead of like an all-day session on AI, they're going to do micro learning sessions, like just take small pieces of different types of things, like maybe start with like a 10 or 15 minute segment on IDG meetings and how AI can help with their IDG meetings, case conference meetings, those types of things that won't really affect the actual care, but it's going to start teaching them about how to use AI. So another thing that they can do is they can just improve their narrative documentation and things like that. We'll have more education on that in the future, but that's one of the things that's going to help them. It's going to help them save an awful lot of time in documentation. And there are already some tools out there that are available. And I know that Axxess is looking at a lot of different types of tools to help with the EMR inside of the EMR. And then I would recommend that they would take just one case at a time with each individual nurse or clinician, not just nurses. There's going to be therapists and social workers involved in this as well. But just take one case at a time and teach them how to use AI, looking at the missing elements that they may have in the documentation. So actually maybe put a note in and then see what the AI comes out with, and then take a look and see what's actually missing that the AI didn't actually pick up. And so then another thing is I would recommend and we do this a lot with introducing folks to EMR, have like a champion, a clinical champion of some sort, a super user that would really understand it. Maybe they would go take classes or something. So they'll be that support person for the clinicians as they go through this transition and using AI on many types of things. And it'll include it. And eventually, and I think it'll probably happen sooner or later, it's going to include documentation, and clinicians are going to find they're going to save a lot more time in using AI, and they're going to get part of their life back. They're going to be able to spend time with their families and that type of thing. So I think that just to summarize this part of it, I think it's something that's incremental. I think if we throw it at them all at one time, it's going to be a challenge, and the anxiety is going to increase. I think doing it in small bites is going to be the way to introduce it to the clinical staff. Things that are relevant, that are actually clinically grounded. AMR, I have a friend who's an attorney who said to me, AI right now is really stupid. It's not as smart as we want it to be, and it's going to get smart really, really fast. And now I think that Elon Musk is probably working on ways to get that done. So I think that we're going to see things come full circle before we expect them. But we're going to see that all the AI that eventually comes out is going to come out to looking at real outcomes for patients. It's going to be some things that we're not even going to remember, or not remember, but not even think about, that AI is going to be able to pick up and give us some ideas, so that eventually, that's probably maybe 5 or maybe more than that years down the road. Eventually, we'll probably start getting less audits, because it's almost going to be audit proof once AI is able to do everything it can do.
Thank you, Arlene. Excellent advice. That's great. I think taking it in small, bite-sized pieces is the best way to, try to get yourself up to speed on any new task or tool. So That's what we've been saying over the course of these monthly webinars that we've been having. It's all about learning slowly, learning properly, and then making sure that you're fully informed before you go ahead and adopt. So, Wendy, let's move on to AI adoption. How do high-quality clinical data and pilot-based implementation strategies support effective AI adoption?
Thank you, Deb. And truly, Arlene and Tammy have mentioned the importance of trust, right? Trust in AI, trust in technology, and how do we level that out? And that's really through data. Data must be the trusted resource as the foundation of adoption. And as we focus on streamlining operations with AI, we really must consider that AI is only as strong as the clinical data feeding it. And so also with that, the discipline of how AI is deployed throughout an organization and throughout our industry. That's incredibly important to develop that trust and ultimately adoption. And so AI does truly rely on structured, accurate, and timely clinical documentation. So we need to get there as an industry, and we know this. When we think about testing AI workflows, refining process, and then ultimately building that clinician trust, there's some important things we need to consider when we think through trusting AI workflows. In care in the home, trusting an AI workflow really isn't about validating an algorithm. It's about validating how intelligence moves through human care teams accurately and enhances the compliance and enhances the clinical decision-making and ultimately the engagement between the clinician and the patient. That's what's really important there. And so when we test out these workflows for trust and accuracy, that involves understanding from the clinicians, from the clinical team, where does the AI output occur? Who sees that AI output first? And does that change the documentation behavior? We want to ensure there's no duplication of work, no alert fatigue. How many of us on this webinar have alert fatigue? We have alerts everywhere, right? Sometimes we become fatigued to those and then they lose their power. And so from a clinical perspective, we've got to learn to trust where that's coming from. And then no ambiguity in ownership. We've got to maintain our clinical structures that we have in care in the home and how we execute on those. Through all of that, we do create that operational efficiency and a strong foundation for the adoption. But then when we think about the process refinement, and this is really where AI becomes truly transformational. If we're using high quality clinical data plus that disciplined implementation strategy, we will refine our core clinical and operational processes, which is what drives that adoption. So what I'm really saying is that AI drives process maturity. And if we accept that, we will see gains accordingly. The technology supports the refinement through the efficient and intentional workflows that we develop. But oftentimes today, we're creating processes because of what we perceive as gaps in technology or true gaps in technology for our execution. And AI has the ability to transform that and automate all of that. And we need to lean in and trust there from a process perspective. And then Arlene mentioned it, and I want to underscore, Deb, you underscored, I want to underscore again that phased AI implementation. That does reduce the process disruption and actually will improve our adoption aligned with a process refinement, because AI will force that process refinement organically. And if we think about the workflows and the process refinement, ultimately we will build clinician trust. And that trust is at the heart of the AI adoption. That's what really matters. Truly, AI doesn't generally fail because the models fail or it's inaccurate. It fails because the clinicians stop trusting it. And we've got to lean in there as leaders in the industry and make that difference, because high quality data implementation strategies will transform that AI from the tech feature that we hear about to the actual tool. And Tammy and Arlene talked about the tool, AI as a tool, but that tool that clinicians trust as a clinically meaningful decision support. And if we have a clinically meaningful decision support while we're out in the home caring for patients, that's a game changer. Thank you.
Thanks, Wendy. That was excellent. It was a great description, and it talked about, kind of has flowed from what Tammy and Arlene have been talking about, how you have to take it slow and phase it in. So we're going to move to Tammy now and ask her to speak about change management strategies that can help build clinician buy-in and trust during the pilot programs and early phases of AI adoption within home-based care organizations. Tammy?
Sure, Deb. Before I continue, I just want to do a sound check. Can you hear me okay?
Yes.
Okay, thank you. I had some feedback that I was a little distorted at first, so I added headphones. We love technology, right? And you can tell that Wendy and I and Arlene have worked together for quite some time, because trust is the pillar of really everything for change management. Intentional change management builds trust. And if we go at it and we design it correctly, we're going to build that trust that Wendy talked about. Arlene mentioned starting small. Start with small pilot projects and maybe things that don't impact direct patient care. Arlene mentioned IDGs. That's a great place to start case conferences, where you can do something that's not going to directly impact patient care, and then you can implement pretty quick feedback. So I think that starting small is a big underlying concept, but also start with a problem. You don't just use AI because AI is there. What problem is it solving for the organization? And how do we do that? We really look to our AI champions. Who are those informal leaders? They're usually your frontline leaders, your nurse, your PT. Maybe it's the person that's been there the longest. Maybe it's the person that is the most vocal about not wanting AI. You convince them first and make them a champion, everybody else is going to follow. And the really fun thing about AI champions is, they can tell the use case stories. We can talk about it. We can talk about functionality. We can train on it. But when someone actually uses it for an impact, when they actually find out that, instead of documenting to 7 o'clock at night, they're finished at 3 o'clock and they're home to pick their children up from school or to see them off of the bus. That's impact, and that makes a difference. The training pieces, I love what Arlene said and Wendy reinforced. Keep it short. We like to talk about shorts. We're immediate now. Everybody is fast. YouTube videos. If I want to know how to do something, I YouTube video it. And I'm not looking for the 30-minute video. I'm looking for the 5-minute video. I want a quick fix, right? Everybody wants it quick. So those short bursts of trainings that are repetitive, that we repeat often, those are a good way to layer in change management. I think engaging early is important too. If we haven't started engaging now as an organization, we're already behind the curve. And we know that as an industry, we are behind the curve. So let's start engaging early in small things. You got to get on the boat someplace, right? You've got to, or get on the bus someplace. And if you don't, you're going to get left behind. Feedback loops. I want to mention feedback loops because I think those are so important. You can form committees, you can form teams, you can have your champions, but it's so very important that our clinicians are able to provide feedback consistently and continuously. They need to be able to say what's working, what's not working. But let me tell you, if you let them tell you that, you got to do something about it. That's where the quality improvement comes in. If they're providing that feedback, that this just isn't working, it's not, well, you just don't know how to use the tool. It's probably processes. Wendy and her team deal with processes all the time. And you don't layer in technology on top of a bad process because that's just going to make an even worse operational problem. And then lastly, I think communication's key. I mentioned that as clinicians, we're a little afraid of AI. We're afraid of it in many ways. We're afraid that, is it going to take away my job? Is it going to change my job so I don't even enjoy my job anymore? Is it reliable? I think organizations need to be extremely transparent. I think they need to communicate often, because when there's a communication void, then that's when the gossip mill gets going. And that's where you hear all sorts of things. Oh, I hear our productivity is going to go up to 10 patients a day with this new AI tool. That's another fear of nurses. They're afraid they're going to have to manage more because they have the tools that helps them manage more. So if you don't have someone in leadership communicating, and it flows down to that clinician's level, they're going to make their own reality out of it. And we don't want that. So for me, I think, change management is going to be successful, as Wendy said in the beginning, when trust is built. And building trust, again, I'm going to go back to education. It starts with laying that foundation with education.
Thank you, Tammy. Very, very practical advice. Let's move on to Arlene. Arlene, again, you're out there in the field helping organizations, home health and hospice organizations around regulatory issues, compliance, workflows, all these different things. So when we're moving to something new like artificial intelligence, I know you've been telling the providers that they're not out there all on their own. There's help. Your EMR, your technology partner is there to help you. In terms of, how you can infuse AI into clinical workflows, regulatory requirements, and data structures. So tell me a little bit about partnering with your EMR and how that can be really effective for your organization so that you feel like you've got the support behind you and the expertise behind you so that your clinicians and your organization can be successful.
Well, one of the things that is a truth is that those folks that are still on paper, and there are a number of them out there, are not going to be successful with AI. They need to have an EMR partner, a partner that understands AI for efficient and safe and effective care that they're going to be providing with the use of AI and making sure that it's adopted safely and in a trustworthy way, as both Wendy and Tammy mentioned. But first of all, I think that they need to realize and they need to make sure that when they're looking at an EMR, that place is the single source of truth. We hear our owners say that often, that this is where we get all of the information. So everything that we put into our EMR, we want to make sure that we get quality information back out. So when the AI tools are layered inside or outside of the EMR, without an integrated organization and that's incomplete or delayed, and certainly those folks that are still on paper or on very inexpensive EMR tools that you can find on the internet that don't have the ability to be that single source of truth, is going to be a problem. So that in itself is going to create compliance issues. It's going to create vulnerabilities for folks. And so making sure that you have an EMR that is working to make sure that your billing is done properly, that your documentation is done properly. All of those things are issues that the clients out there need to be really paying attention to. And then making sure that the workflow alignment is built into the EMR. So the clinicians are all used to using workflow now. So just making sure that AI is part of their workflow is going to be very important. And then all of us have been talking about these short incremental training sessions, so that workflow should be introduced in the same way, in short, small bit, not just a whole change in the EMR where it includes a lot of AI. So that's going to be a big part of it. Another thing then is making sure that EMR and any AI that is built into it or you're able to use has regulatory and compliance issues built into it, and data security. That's huge. The fines for insecurity with data are enormous, and we don't want to run into that. So you want to make sure that you have a vendor who's going to be regulatory compliance, and then that data security built into it. And you can ask those questions as you're out there looking for vendors. And then I guess the last thing that I'd like to say is that making sure when you partner with an EMR vendor that they have accurate information from AI, that it's compliant with the conditions of participation and also Medicare policy. And I can tell you that, and I think we're going to talk about that a little bit later, the federal government's going to get involved in this, and they're going to be putting some strict guide rails up so that we're going to be probably doing things a little bit differently as far as that's concerned. So your surveyors and those auditors are going to be looking for like copy and paste and things that really couldn't have happened with a particular patient in your documentation. So those things embedded in the workflow and that is scalable also are going to be things that you want to look for when you're choosing an EMR. But again, those folks that are still on paper and doing things the way we used to do them 25 years ago are going to struggle with this. And so my hope is that at some point, everyone's going to be on an EMR that they can trust, and AI is not going to complicate matters for them.
Thank you, Arlene. I appreciate that. So let's move on to Wendy. Wendy leads our client success organization, and she deals with many, many different home-based care clients and all around the country, and of all different sizes and all different sophistications. And I think each of these organizations, no matter what size they are going to want to start working with AI and they want to ensure long-term success with it. They don't want to have a pilot program or start with it and then, end up stopping or going backwards. So, Arlene, you were talking about partnering with your EMR in a way that makes sure that you have long-term success. And I think Wendy's got experience there and maybe can tell us, give us a few examples of some of the things that a provider should be asking of their technology partner to ensure that this process is going to go well and it's going to be sustained and grow in a very positive way.
Yes, absolutely. Thank you, Deb. Trusted partnership is key to success. And I will tell you that our clients and our client partners that we're working with, they are asking questions. AI is here and moving quickly. And understanding how to navigate AI for the long term and for that long-term partnership is critical. So in a trusted partnership, thinking from a clinical, regulatory, and then data perspective, what do we ask for as a trusted AI experience, and then of course for the future? When we talk about clinical workflows, some of that clinical workflow integration, Arlene touched on this, and asking the question: is AI organic and embedded in the clinician workflow, or is it something that the clinician has to go to? Adoption will be so much greater for us as clinicians if the AI is embedded in our workflow and we're not feeling it. It's happening for us. Does AI support OASIS accuracy? When we think about the HOPE assessment tool, does AI support the HOPE assessment tool and then the subsequent visits that come along with that? Can technology predict a LUPA risk? That's important when we think about that from a patient outcome perspective and also from a financial perspective. Lots to talk about around that. Does AI summarize documentation for us? How does that happen? How are we getting clinical summaries? Is that happening organically in the solution with the data that we've put in? From a compliance perspective, how is that working? And is AI able to predict patient status? That's important when we think about workflow, because all of that leads us to better patient outcomes, decreased cost, increased revenue, consistent regulatory compliance. Very, very important. So moving into the regulatory requirements, AI compliance without that safeguard that Arlene talked about will create exposure, and we don't want that. We live in a highly regulated industry, and I think as clinicians, we love that. We tend to be rule followers. We support that. But what does that mean when we're partnering with a technology solution that will drive our business? So how does AI adjust to BGM, to the hospice payment updates, to any of the evolving CMS requirements, really? How are we adjusting that from a technology perspective within our solution? And in that same framework, then, how frequently are the AI models retrained when those regulations change? And how will we feel that as a provider? What does that look like for us, for our clinicians, and for our team that is supporting our clinicians, perhaps in the office? What does that feel like when the AI is being retrained? And then again, that safeguarding piece and monitoring for accuracy. How are we monitoring with the data involved in AI for consistent accuracy along the regulatory requirements? And then from that data structure and security perspective, security is an important word in our industry right now, and really the foundation of AI success. And I think, not just in healthcare, security has been part of the underlying importance of healthcare for a long time. But now that we're looking from a technology perspective, that definition of security changes a little bit. And we need to be asking those questions as providers. So how is the data normalized across the clinical, operational, and the financial modules? What is that process looking like, and how are we ensuring HIPAA compliance and architectural security? Those are, significant concepts that we need to be in tune to and plan for and understand from the provider perspective. And then how does the solution ensure data integrity with interoperability and third-party partners? Oftentimes with any solution, we have other partners that are integrated within the solution to enhance efficiency and functionality. So what does that data integrity look like, and how do we put those guardrails there? But I think that the underlying message is to empower those that are listening to ask the questions. I'm known for asking the second, third, fourth, fifth question. And it's important. It's important to remember that that's how we learn, and we build trust, and we ultimately build that adoption that we're looking for from an AI perspective.
Thank you, Wendy. Appreciate that. So now we're going to pivot a little bit in our discussion. We've spent the last 35 minutes discussing the principles of AI adoption from an educational perspective. In our remaining time, we'll shift to a non-CEU discussion focused on how these concepts are operationalized through Axxess intelligence. So Arlene, we're going to go back to you and get back into the federal government regulatory world here. So Arlene, federal agencies, including the Department of Health and Human Services, have issued requests for information and guidance related to the safe adoption of AI in healthcare. So how should organizations interpret this increased federal attention?
Well, one of the things they should recognize when the federal government gets involved in anything, it's a signal that it's inevitable, right? It's nothing that's going to change, and that we're going to have accountability. That's why I mentioned earlier about I do believe that at some point in the next few years, we're going to see a major change in the conditions of participation, because the surveyors are going to be looking for that accountability. So it's not an experiment any longer. It's an expected component of healthcare delivery. And so we're all, whether we like it or not, we're all going to have to get used to it and know that's just going to be part of what we're going to be working with. So the federal agencies know that there's potential risks out there. They know that there's things that are related to patient safety that they have to be careful about, bias. And then, like Wendy's been saying, the data integrity that we have to make sure that we have right. So there's going to be a lot of oversight, and particularly with our organizations. This industry is, like Wendy said, heavily regulated, and it's going to be something that they're going to be watching very, very carefully. So the other part of this is that we need to be looking at this as a formal governance and expectations. And so putting this AI in, I think Tammy mentioned this, in your QAPI framework, making sure that your QAPI organization is picking up on any issues with the AI that's being used. And I don't know that we've mentioned this before, but I think that organizations also should have policies involved where they allow only certain types of AI to be used outside of their own EMR, if that's what clinicians are doing. I think they have to be very careful with that. And QAPI should be a big part of that in dictating what types of AI, if it's not all embedded in the EMR, that they should be looking at that very carefully. And then making sure that you have governance policies. I think that's going to come sooner than later. I think the organizations should start looking at that now and looking for resources where they can get governance policies for AI. Of course, that's going to grow because AI is going to change over the next number of years, and that governance policy is going to have to be expanded. But I do think that that's something that organizations should start looking at now and actually make sure that they have it fully implemented probably by at least the end of this year. And then the next thing is with the RFPs that are going out, but with DHS, that is they're going to prioritize transparency here. And so at some point, I was talking to one of my friends and I said, at some point, the government's going to be able to not even ask for our clinical records. They're going to be able to see everything that they need to see online and make denials, just blanket denials just based on what they can see. Maybe they're using AI. I did hear that one of the survey departments was using AI in part of their surveys, and I don't know if that was true. That's just someone told me that, but I heard that was already going on. So those are some things we have to be paying attention to. So, but the federal government, I think, is also looking at opportunity. They want to make sure that they're working with organizations that align with their guidance and making sure that I think that they're going to be more involved in the application process. Those will probably be some of the things that we're going to have to answer when we apply for licenses in home care and hospice. We're probably going to have some answering to do with related to AI. And then I think that the clinical and regulatory parts in our policies and procedures, the training, all of that's going to have to be proven out. So when surveyors walk in, we're going to have to explain how we're governing all of this, what we're watching, and how we came to the point where we developed the policies that we developed. And of course, they're going to have to align. I've heard that the federal government will be, I guess some of the states actually have some AI guidance out there now, but the federal government is going to be the overall place that we have to answer. And then you'll also have to work with your state policy. So it's just going to be another item that organizations need to be aware of and be watching for and do the reading they need to do the training they need to do. And as we switch to our non-CEU portion, we'll talk a little bit about that.
Thank you, Arlene. There's good cautionary information in there for everybody, but I fully agree with you that CMS is pushing the home-based care sector to be more sophisticated, to use tools like AI properly, so that we really can be that critical portion and part of the integrated delivery system. We want to be that sophisticated piece that everybody can rely on. Hospitals, skilled nursing facilities and others really need us as we move forward in this value-based system. So right. I actually think that this is going to be helpful to us as a sector. And I think that an organization like Axxess is doing some wonderful things to be AI first, AI forward thinking. And I want to go to Tammy to ask a little bit about what are some of the things that Axxess is doing to play, a role in supporting responsible AI adoption throughout the industry and within individual home-based care organizations.
Thanks, Deb. And now that we can speak freely about what Axxess is doing as we're non-CEU at this point, I think our public policy is huge with AI. Deb, that's, your wheelhouse and the things that we're doing for AI as far as lobbying. Making sure there is responsible AI is huge. Axxess has had Axxess Intelligence, which is AI, around for many, many years. What Axxess has done differently is I think that they led with the problem, and then they came up with the clinical decision support. There's a lot of things that AI can do, but is it really helping solve the problem? And I just want to give a few examples. Wendy kind of alluded to some of them when she talked about technology companies and kind of what you should look for in your partner. And Arlene, you did as well. But, our clinical dashboards that we have for predictive analytics within Axxess are far beyond, any other vendor's dashboards that I've seen. What they do is they allow a clinician to easily look at that dashboard and determine need for that patient. We can all relate to that as clinical people on the call, and even as non-clinicians. There's never enough time to do everything you want to do, but you want to be able to deploy those needed resources when you can. Using predictive analytics lets us look at patients that are starting to decline. Maybe they need a different level of care. maybe death is expected within 7 days, and we really need to amp up our hospice visits, both for the outcomes for that patient so that they can have a very smooth transition, and for the family. So these dashboards allow us to do that, allow us to balance that acuity at a glance. Again, that's Axxess Intelligence. Other things that I really like in our software system is the clinical decision support that's built in throughout the software, especially for OASIS documentation. Now, all of us are probably at the age where we remember doing OASIS on paper. All of us speakers anyway. 22 pages. I wrote my name 22 times on an OASIS document. There was huge potential for human failure, huge potential when you have a 22-page document. And all that information is still required. But with Axxess, we have OASIS support. I call it nurse on your shoulder. It's like having somebody with you out there in the field. And those of you that's carried a bag, you went in to see a patient, you know how scary it is to be in that home and not to have any resources. There's not a resident around. There's not a director of nursing. There's not a chief of the ward around. It's just you and that patient. So if you have a question, I mean, certainly you can call and get out on the phone with somebody. But if you have a question, isn't it wonderful that you have that built into your documentation system and you're able to see the answer to that just immediately? That's with our OASIS Integrity and our nurse on our shoulder, and with Ask Axxess, it's right there. And I think one of the biggest fears, and one of the things I think maybe some operators and financial types don't get, nurses really do understand financials. We really do understand the impact of the dollar, but we want to see it translate to the good of our patient, right? So we want to see dollars translate to outcomes. So using our concurrent billing system that compliantly checks all of the billing factors to make sure that we meet all of those COPs allows nurses not to fear that, I didn't document this correctly for billing. Maybe, my agency is not going to be reimbursed enough, and maybe that's going to result in a negative outcome for our patient. So having those built into our EMR system, and I could go on and on. That's just 3 of my favorites. I have a lot of favorites, but that's 3 of my favorites. I think that allows organizations to trust Axxess. We're not new at this game. We didn't just start this in the last 2 or 3 years when the big AI rush started. This has been tested and tried year after year after year. And we've proven that with being able to produce outcomes that far exceed national average in many, many cases with our clients. And I'm sure Wendy can tell better success stories, but we have tons of success stories that support Axxess Intelligence leading to those better outcomes. That's how you build adoption with clinicians. You tell them how it affects their patients, and then you show them evidence-based that this truly works in solving your challenge or your decision. Thanks,
Thank you, Tammy. Appreciate it. Wendy, let's continue with you. Let's talk more about Axxess Intelligence, but on the clinical and operational side. Talk about how AI is used to grow provider revenue, efficiency, compliance. Those things are all built in right now to Axxess Intelligence, but what other tools might Axxess be thinking about or have in production and slated for development in the future?
Well, Deb, thank you. And Tammy really spoke to Axxess Intelligence as it's already organically throughout our suite of solutions. And our clinicians and our providers are using Axxess Intelligence daily, some knowing and some without knowing, because our philosophy has really been that integrated approach. And as we've talked about throughout our time here today, that is so important when we're focusing on clinical adoption of technology. That integrated approach where we're not feeling it and it becomes automatic is just the key to success. So our clients today, and Tammy's right, I have a lot of stories I can share, and I'm happy to talk about those all the time, anytime. But our clients are truly experiencing real-time gains and growth leveraging Axxess intelligence, including increased patient outcomes through our clinical documentation automation and thinking about real-time validation throughout the solution that leads to accuracy and efficiency. We're seeing star ratings increase by 1.5 to 2 stars in a short amount of time with our clinician or with our clients, and that's really rewarding, and it's important in a value-based world today. As clinicians here on this in this time together, we're all here for improving patient outcomes, and that is significant. What technology and Axxess intelligence is fostering for us to be able to make that difference and make that change. Our clients are seeing a decrease in cost through our Axxess intelligence scheduling and proximity map. And so what that does, it aligns the clinician schedules with patient proximity and need. So it reduces the scheduling conflict and the windshield time, which is great for clinicians and certainly also for our patients and families. But it's truly decreasing that cost through that efficiency of mileage and time, and that's phenomenal. We're increasing regulatory compliance through Axxess intelligence with our automated summaries, our auto-generated summaries through the clinical documentation, and that's for both home health and for hospice, which is phenomenal. We're streamlining operations for our clients through Axxess intelligence with the eligibility reporting. And we're increasing our revenue, as Tammy talked about, with our business intelligence and the dashboards, where we are able to see very quickly through those business intelligence dashboards gaps in operations, areas where clinical efficiency and clinical outcome may need additional support, and it enables our providers to lean in and act on those immediately, which can change the scenario. Now, of course, I love that I get to talk about what's on this screen today, which is a little bit of the upcoming for Axxess intelligence, that Axxess, the clinical AI agent and the billing and revenue cycle agent. That's exciting. Some of us on this webinar today are currently using Ask Axxess. We've had that experience, and we will see Ask Axxess continue to evolve throughout our full suite of Axxess solutions. And what this does is it fosters ease of use in locating that needed information right at your fingertips within the solution. So asking Axxess anything we need, folks who may be at high fall risk, folks who may be on a specific medication, and categorizing that, and allows us to really streamline operations, but also focus in on what's clinically important, just at our fingertips throughout our suite of solutions, which is phenomenal. And then our clinical AI agent, this is ambient listening. And we hear a lot about ambient listening right now in the care in the home space. And it's important to talk about from an Axxess perspective. This is our mobile clinical documentation agent that securely captures patients' visits in real time. And that reduces then that manual documentation time because it streamlines what's happening within that visit, converting the visit right into a structured documentation. And ambient listening is truly a game changer for clinicians. As we trust technology, ambient listening changes the mindset of a clinician from actually creating that documentation to naturally using our skills bedside with that patient and validating the information, which opens that space for a greater experience and outcome for our patients and their caregivers in the home. And so that's incredibly exciting. And then our billing agent, this optimizes the revenue cycle management by really automating that the claim validation, which will reduce those denials and ensure that we have that first rate pass that we need. The billing agent will provide a dashboard that's actionable in real time so that we have visibility and we can make those changes that we need to make. Much more to come. And we started this time together with Agile. We'll end this time with Agile, our Axxess growth, innovation, and leadership experience. But that's where we will be really showcasing all of Axxess intelligence in excellence. So it's exciting, Deb. Thank you.
Thanks, Wendy. Yes, I mean, the future is here, and you've kind of, given us a peek into the window now, and it's really going to be changing the industry and really helping the providers across the full care at home continuum. Earlier in the webinar, Tammy mentioned something about artificial intelligence, and she said, you don't just use it for using its sake. There has to be a problem that you want to solve. So one of the big problems that we've had in home-based care delivery over the past, since COVID, 6 years, is workforce. And I just wanted to go back to Arlene for a second and ask about how Axxess Intelligence, powered by AI, is supporting staffing efficiency, sustainability, and workforce distribution across the teams within an organization.
Well, thank you, Deb. This huge problem, and it's probably one of the biggest problems we have now, and in the future, we don't really see a stop in that. Tammy does a lot of talking engagements about workforce shortage, and a good portion of workforce is older nurses, so that impacts the organizations if they start leaving and we don't have the replacements for them. We've got such tight margins now, and they're going to get tighter. MedPAC has already said they're going to try to cut us another 7% next year. It's just incredible. So we have to learn to do more with less. That's kind of the bottom line with this whole thing. But with Axxess Intelligence, it's going to give it gives everyone a way to do a reactive staffing rather than something data driven that is going to support the not to do reactive staffing. That's going to support the clinicians out in the field. That we're going to be able to improve patient care, and then we're going to have the documentation to support that. So the reactive staffing that we're doing now is just hiring people as we need them. The data-driven staffing allows us to have information ahead of time so that we know where we're going. We know what type of workforce we need. We're going to have to look at more technology, not just AI, but more like telehealth and remote care monitoring in the future. That's going to help us get better outcomes. And I'm hoping with some of these RFPs, the federal government's going to finally realize that we actually need that and we need to get paid for it. And I think the more contact we have with our legislatures that I know that you are in charge of, Deb, in our organization, the better off we're going to be. So people have to start working and trying to push that forward with the federal government. But and then the visit utilization and the productivity, Axxess Intelligence able to reduce those LUPAs, missed visits. We're able to take a look at that and know whether we have poor scheduling habits or we have nurses with poor habits or clinicians with work habits, and then have a workforce distribution that's available to us through actual data and not just looking at the schedule. And, if you have a bad scheduler, you're probably going to have bad outcomes with your patients. And that I know that sometimes folks don't look at the clerical staff inside, and some, even the receptionists. The receptionists and the scheduler are going to affect our HHCAPS results. It's going to affect that. They ask about that. In HCAPS, they ask about how the agency actually responds to that. So all of those things can be corrected with using Axxess Intelligence. And then the geographic routing, Wendy mentioned that about windshield time. My goodness, most of our clinicians spend about 30 to 40% of their time driving. So that's so important. And I remember one time somebody said to me, do you want to be a star a star nurse in your scheduling of your patients, and they all say yes, and they say, no, that's not what you want to do. You don't want to go from one place to the other and then to the other and to the other. You want to make sure you have everything geographically put together so that you are going the shortest distance possible. You may have a nurse that lives a block away from one patient, and you're scheduling somebody who lives 50 miles from that patient. And so Axxess Intelligence helps us take a look at that and makes us see where the best placed, and they can actually provide that to us. They can say, this is how how it should go. And again, like Tammy said, it still takes a human to be looking at this and make sure this is correct, because AI does, and it will continue to make mistakes. It's not 100%. It's not a brain. It's a piece of technology, and it's taking information that our brains are putting into it, but it doesn't really. It's not able to coordinate some things. And so the other thing, and I think Tammy mentioned this, is patient risk stratification, particularly in hospice. We've got some risk stratification built in there that will kind of give us a heads up when we think it might be potential to provide the programs that hospices provide, providing more care for that patient at that last week. And that those are some things that I think are just really, really important. And then helping with retention and burnout, of course, the time spent in documentation and that type of thing, using Axxess Intelligence, as long as the clinicians are trained to do that, that's part of orientation. That's part of what training certification we have at Axxess has a very good handle on. We have excellent orientation tools in Axxess training certification. And we are building right now training for AI. So we don't want to forget that. We want to make sure that clinicians know, and those that are still on this call that are using Axxess know they have that available to them. And then finally, from a financial perspective, we can assure that the levels are balanced with patient needs. You're going to save money, like we said, in the inefficiencies in, mapping out geographically where folks are going, improving your data accuracy. So hopefully we're going to have less ADRs. I can also tell you, I know Wendy's got a lot of stories, but a really quick one from me is that we have a vendor. It's Gateway Coding and Consulting, and their primary nurse who does the ADRs and that goes to the administrative law judge, and that has told all of us that Axxess has the best EMR as far as analyzing whether the care was actually provided and the type of care, the adequate care, and the outcomes were good. He said it has the best documentation of all the vendors. I mean, that's a statement he's given directly to me. So I know he's good at that. So I just think that Axxess Intelligence just adds that layer that we need to make sure that we have everything included in the documentation that needs to be included.
Thank you so much, Arlene. We're coming right up to the top of the hour right now, so I think we'll probably wrap with this. What I'd like to say is Axxess is committed to educating and training the entire care at home industry. It's clinicians, it's leaders, it's billers, people that are working the operations, and they're doing that through training and certification. And Tammy Ross and her team have been leading that. It's been just terrific. And it will be expanding, as Arlene had mentioned, into AI. We've been continuing these monthly Axxess AI webinars, and we're going to be continuing to do that. And then obviously we're moving close to our annual conference called Agile, the Axxess Growth, Innovation, and Leadership Experience. So you'll learn more about that. But before we leave, I wanted to give us a really strong thank you to each of our Axxess panelists: Tammy Ross, Executive Vice President for Professional Services; Arlene Maxim, Senior Consultant of Clinical Services; Wendy Conlon, Senior Vice President of Client Experience; and to all of you, our audience. We had over 630, I think, registrants for this webinar today, which is a really strong turnout. We thank you all for continuing to try to learn alongside us. So We heard about Axxess Intelligence. If you'd like to learn a little bit more about how that can help your organization become an AI first provider, visit axxess.com. We mentioned our Agile 2026 conference. Join us in Dallas. That's May 4th through 6th. We hope that you'll be able to register right now online with us. We've got all kinds of programs to schedules out there. We have wonderful sponsors and supporters. It's going to be a fantastic experience. Please join us. Look for an email in the next couple of days. We'll send you a link to the recording of this webinar if you'd like to share it with your team, and the slide deck that was shown today. We'll be having another webinar next month. Look for more details on that. And we'd like to just close out by saying thank you again for joining us. We thank Axxess for its commitment to its education on artificial intelligence and bringing the industry along. Have a wonderful day.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.